Hello viewers, welcome to the live teleconference program of Department of Business Management of Dr. B.R. Ambedkar Open University. Today's session is on healthcare analytics for managers, improving quality, cost and patient outcome. This topic has been selected from Healthcare Analytics course of our MBA Hospital and Healthcare Management program. Before we initiate discussion on the topic, there is a small announcement from the department side. The university has issued notification to conduct entrance test to admit candidates into its MBA General and MBA Hospital and Healthcare Management programs for the academic year 2026-27. The candidates qualified in either ICET Integrated Common Entrance Test already conducted by the Government of Telangana or the entrance test to be conducted by Dr. B.R. Ambedkar Open University are eligible to seek admission into both the programs. The last date to submit the application form to appear for the entrance test of Dr. B.R. Ambedkar Open University is 5th August 2026. This is without any late fees. With the late fee, the last date is 16th August 2026 and the entrance test is going to be conducted on 23rd August 2026. So, candidates wish to seek admission into either MBA or MBA Hospital and Healthcare Management programs can register themselves and appear for the entrance test. Candidates who are already qualified in ICET and want admission into MBA program, because the admissions process was already commenced, so straight away they can log into the university online web portal and follow the procedure and take admission into the MBA program. But the candidates wish to take admission into MBA Hospital and Healthcare Management program, they should wait for admission counselling. After the declaration of the results of the entrance test to be conducted by the university, then the university will announce the admission counselling dates. So, the candidates have to attend the admission counselling and then take admission into the hospital and healthcare management program. So, please remember the dates. The date of entrance test is 23rd August and the last date without late fee to submit the entrance test application form is 5th August and with late fee it is 16th August. Please don't miss this opportunity. Now, coming to the topic. Nowadays, every industry, rather every organization is undergoing a rapid digital transformation and healthcare industry is not an exception. In fact, to say, the healthcare organizations or the hospitals are collecting vast amounts of data. This data may be clinical data or non-clinical data or operational data. Proper analysis of this data will definitely help the organizations in improving the quality of services offered to the patients, patient outcome, managing the resources properly, reduce the cost of operation and so many other benefits are attached. It will definitely help the organizations in managing them efficiently and effectively. So, to explain more, because there is a lot to be discussed on this topic, so I am not taking much time to explain us various aspects relating to healthcare analytics. We have two eminent resource persons with us today in our studios. On my immediate left is Professor G.V.R.K. Acharyulu, sir is a Dean School of Management from University of Hyderabad, Central University. And next to him is Professor D. Srinivas Kumar, sir is also professor and from the same school, School of Management, University of Hyderabad. Incidentally, both the resource persons are from the same university. I welcome you, sir, and thank you very much for accepting our offer and being with us today in our studios. And both of them, they have experience not only as academicians, they have attachment with the industry also, they have industrial exposure also, both the resource persons. So, today they are going to explain us what is healthcare analytics, what are the different types of healthcare analytics, how the analysis of healthcare, this data collected by the hospitals will benefit the organizations in different ways. And before actually we start the discussion, let me announce the telephone number. The telephone number is 040-23680-456. The telephone number is 040 outside from Hyderabad 23680-456. So, the discussion initially will take place for 40 minutes. It should be a structured discussion, and the remaining 20 minutes will be open for interaction with the resource persons. So, if you have any doubts or if you want to seek any clarification from the resource persons, please use the telephone number and seek qualification. So, keeping in view the analysis of the data only, the Department of Business Management has introduced a course on healthcare analytics in the 4th semester of our MBA Hospital and Healthcare Management program. So, shall we start our discussion, sir? Yes, sir. So, my first question is to Professor Acharyulu, sir. Sir, what is healthcare analytics and what is its role in the present environment?
So, the role of analytics is very crucial in this present environment, as hospitals or healthcare organizations are really going for digitalization of their operations and their financial data and also the clinical data. So, the hospitals, most of the hospitals generate lots of data. So, how to use this data in systematically to support operational decision, patient safety and also financial decisions and clinical decisions. How this data can be converted into or transformed into a meaningful data and creating insights to predict, to support the decision making and what is going to be taken future course of action. So, there lots of data is going to be there in hospitals. This data is going to be generated based on when the patient enters into the hospital, from billing, registration and appointment, and then doctor consultation, and then diagnostic labs and pharmacy, and then all the patient finally patient satisfaction study. So, from patient step in to patient step out, so lots of data is going to be collected at different touch points. So, how do you make use of this data? This healthcare analytics looks at converting this data into meaningful insights for decision support and also for efficient patient outcome and patient care, and also the different kinds of clinical decisions and also operational decisions and financial decisions. All these things are very important in the healthcare analytics. So, I think this is very important area that we have to focus on healthcare analytics, and this is a growing area.
Thank you, sir. Srinivas Kumar, sir.
Right.
So, what are the different types of healthcare analytics?
Okay, madam. Good afternoon, madam. Good afternoon, sir. Yeah. Coming to the types of analytics, when we broadly look in terms of classifying the analytics into different categories, we observe that these analytics could be classified into majorly 4 different areas. One is what is known as descriptive analytics, then comes what is known as diagnostic analytics, then comes something called as predictive analytics, followed by prescriptive analytics. Now, coming to the descriptive analytics, basically this descriptive analytics give us an idea in terms of what has happened. That means when we are looking at this particular data, the data will give us an idea in terms of what has happened. Say, for example, I would like to know the occupancy ratio of the operation theatre, or I might be looking in terms of the occupancy of the beds available in the hospitals. So, basically what I am looking at is, I am looking at the basic data that will give me an idea to get insight into what is happening or what has just happened. Now, coming to the diagnostic analytics is a bit different compared to that of descriptive analytics, because we are trying to find the causes for certain happenings, in the sense what has caused this particular outcome. Say, for example, if I am trying to look at a scenario where the occupancy ratio of the operation theatre has overshot beyond the capacity, maybe I need to look at what could be the reasons for this, which could be there as a part of the diagnostic analytics, right? So, diagnostic analytics basically tries to they try to give us an idea in terms of what is the reason behind something that has happened. Then comes the predictive analytics. When we are looking at the predictive analytics, basically predictive analytics give us an idea in terms of what is going to happen. Say, for example, I am trying to find out what could be the number of patients who might be visiting the outpatient department tomorrow. So, based on the data and using some of the analytical techniques, can I basically predict the number of patients who are going to visit the hospital tomorrow, right? Or interestingly, in some cases, when we discharge a patient, right, out of 10 patients who are discharged, maybe 2 might get readmitted within a span of, let us say, 1 week. So, can I predict which 2 of these patients out of the 10 patients who have been discharged which of these two patients might have more chances of getting readmitted. So, we are trying to look into the future, we are trying to answer the question in terms of what is going to happen. This is where basically we are looking at the predictive analytics. Then comes what is termed as the prescriptive analytics. Prescriptive analytics basically uses most of the optimization techniques where we try to look in terms of finding out a solution. That means what could be done, right? If I need to take a very general example in terms of looking at the prescriptive analytics, if I are using Google Maps, it tries to give us the particular route through which we can travel, which might actually take the minimum time. That means it is basically prescribing you the course of action. Similarly, when we are talking about the healthcare analytics, it could be related to the what you call occupancy ratios, or it could be related to the hospital equipment that is being used, or it could be related to the assignment of the resources. Prescriptive analytics basically try to help us in terms of giving an idea in terms of what can be done or what is the future course of action. So, these are broadly the 4 different types of analytics, madam.
So, descriptive, diagnostic, predictive and prescriptive.
Prescriptive, yes, madam.
So, which is actually more important in the present competitive scenario?
So, interestingly, when we are talking about the types of analytics, one way is each of these is dependent on one another. That means, without having descriptive analytics, maybe probably I may not be able to get into the other areas of analytics. But at the same time, when we look at the value of the information provided by these analytics, right? At the descriptive level of analytics, the value of the information relatively is low, but at the same time, the complexity involved in terms of doing this descriptive analytics is also relatively less. That means it is easy for us to do them. As we proceed, essentially when it comes to the prescriptive as well as the predictive analytics, the value of the information is going to be more. In fact, all of us are very much curious in terms of what is going to happen in the future. So, that is where we find a lot of what we call value being attached to the predictive analytics. Then comes the prescriptive analytics, where the best course of action, we are trying to look at taking the best course of action that would optimize our resources or that would help us in terms of reaching our goal easily. So, if you talk in terms of the value, especially the predictive analytics as well as the prescriptive analytics, they are going to take the lead, madam.
So, they support more in decision making.
Yes, madam. They will help us in terms of taking better decisions.
Better decisions. So, Professor Acharyulu sir, while responding to my first question, you just as a passing reference, you said that these are the different types of data normally collected by organizations. So, I request you to throw more light on what are the different types of data.
Yeah, coming to this healthcare scenario, that data is actually basically 2 categories. One is structured data and unstructured data. The structured data is actually predefined formats where the patient comes in and to the hospital and his age and the location and address and what kind of surgery is done and what are the tests that are done. All the information is available in predefined format, predefined size and characters. So, that data can be easily managed, easy to understand and easy to take a decision. But when you look at unstructured data, which is very important, crucial, that most of the hospitals are going to have 80% of the hospitals are going to have unstructured data. It's very complex data and it's not in a structured format where you can see the, for example, you can see physician prescriptions and MRI scans and also videos and emails and other kinds of texts, and you can see that videographs, all these things, these are unstructured data. So, to have meaningful data from the unstructured data, it is very difficult. This is one category, two categories, but basically other categories, as I already told you, that one is a clinical data and operational data and financial data. So, these are, so like you can say that clinical data is like you can say what is the waiting time of a patient, what are the medical record test data, glucose rate, and what is BP rate, and what is the cholesterol rate. All these things are clinical related data, and operational data is waiting time. You can say that arrangements, appointment date, and all other things, patient information, all these things are this. Financial information is mostly billing, revenue per patient and cost data, all these things are financial data. So, all these data are very important, and these data are to be very, very important for analytics to take a proper decision.
Srinivas Kumar sir, I just want you to throw some more light on this structured and unstructured data.
Okay. So,
which is more challenging.
Okay. So, let me just get into the difference between the structured and unstructured data first, madam. So,
Yes.
when we look at structured data, normally if you look at a tabular kind of a data, where you have very clearly defined columns and then there are rows. Now, this data is relatively easy for us to understand because it is well organized, right. In most of the cases, we deal with the numerical data in terms of a very structured format. This is typically known as the structured data. But then the problem is when we are talking about, as sir has said, medical images, when we are talking about the video data, when you are talking about the text data, maybe the transcripts that are produced while the doctor is interacting with the patients. Now, all these cannot be actually arranged in a very structured format. So, the basic problem here is that you are dealing with the data which is not there in a single format. You are dealing with multiple formats of data. But at the same time, when we look at the kind of insights that we can get using this particular data, it is very much evident that if you are able to generate the insights using this unstructured data, probably you are going to get a lot of valuable information that will help you in terms of better decision making, or that might even help you in terms of better what you call arranging your operations, or maybe it will even have a positive impact in terms of your revenues also. So, that is the promise that the unstructured data is going to give. So, interesting perspective here is when we are talking about the data that is being used in the context of healthcare, we have both structured data as well as the unstructured data. Now, structured data relatively we know very well about it and it is also very old. But when it comes to the unstructured data, the basic challenge is in terms of how we deal with this unstructured data, right. So, it is more challenging to deal with the unstructured data rather than with the structured data, because we have relatively well evolved technologies that will deal with the structured data. The simple example could be, maybe I can look at databases or data warehouses that will deal with the structured data. But when it comes to the unstructured data, the problem is that you need to have a different kind of an architecture that would basically deal with the unstructured data. Say for example, when I am talking about the video data, I have different frames of data. Similarly, when I am talking about the pictorial data, I have different formats of the pictures that are available. Similarly, when I am talking about the text data again offers a different kind of a challenge. So, for this we do have different types of technologies that have come. Say for example, we have Hadoop, which is there as a platform which could be used in terms of dealing with this kind of data. Maybe we also have Spark, which is available, which can deal with this kind of a data. So, when it comes to the challenge, definitely dealing with unstructured data and deriving insights from the unstructured data is more challenging compared to that of dealing with the structured data. But at the same time, the promise, that is the value that is offered by the unstructured data, is also very high. If hospitals could leverage from the value of the data, from the value of the insights that are generated from the unstructured data, that is going to be very useful for them, madam.
Yeah, thank you, sir. Acharya sir, you said that there are different types of data the organizations are collecting. Clinical data or non-clinical data, operational data, financial data. What are the major sources of this data and how the organizations use this data in strategic decision making?
So, the sources of data is going to be mainly from the departments and from people, and from also when you take up a hospital example, the source of data can be from billing to patient registration to consultation to the pharmacy, and so pharmacy data is going to be generated from pharmacy, and operation theatre data is going to be generated from operation theatre, and then finally when the patient is discharging, the data is going to be generated, because all the data can be integrated into the discharge format, and then finally the patient is going to have feedback, patient feedback. That is also one kind of source of data. So, for all these source of data are going to be very, very important for taking a decision and how the hospital is going to be performing in a better way, or in any improvements are to be made. Those things can be identified. And also when you look at this particular kind of data at different from different sources, how do we integrate the data? That is also very important. This analytics is going to look at the integration of data. So, the integration of data is going to look at when there is no duplication of data, and also there is one single data entry will be there, and finally the entire patient information is going to be displayed to the end.
Can this information can be used if suppose the patient wants to visit some other hospital for a second opinion or something like that? Can this data be transferred from this hospital to some other hospital?
Yes, yes. The data the patient data can be exchanged at different hospitals through electronic health records.
Electronic health
EHR records. So a patient is from one, suppose from Hyderabad to Bangalore.
Yeah.
So the doctor is going to access his data based on his the ID. So automatic data is going to be captured.
Because instead of again undergoing all the tests and all these things, sir.
So doctor will be identifying the data and what kind of tests already done and what kind of tests to be done.
For that
everything will be decided. Yeah.
So Srinivas Kumar, so I just want to you to throw some more light on this. And there are two different terminologies, EHR and EMR. What's the difference between these two?
Okay, madam. So when we are looking at EMR as well as EHR, EMR stands for electronic medical records and EHR stands for electronic health records. So when we are looking at the differences between these two, let us say, for example, a patient is getting treated in a hospital, and whatever the information that is related to this particular patient is available within the hospital records. And say, for example, if you are digitizing this or if you are electronically maintaining this particular data, but confined to within this single unit.
Okay.
It could be probably called as what is termed as an electronic medical record. The problem is, if the patient is visiting multiple hospitals, right, this data cannot be carried to the different places. It is there within a single organization. But whereas, when we are looking at the electronic health records are interoperable. So, what we mean to say by interoperable is that the data which is there related to the patient, say for example, can be shared with the pharmacy, it can be shared with the diagnostics, it can be shared with another healthcare provider also, because here everyone is operating at the same standard levels. That means the interoperability is basically available here because no one is confining that particular data to a single organization, but of course taking into consideration the legal obligations as well as the patient consent, this data could be shared across organization. A simple example in this particular context would be very interesting. Now normally when we go to a hospital, especially when we are talking about a corporate hospital, the registration takes almost anywhere from 15 minutes to half an hour. But this data would have been already there with my previous healthcare service provider. Now if there is, let's say, seamless transfer of data from one organization to another organization, we can very clearly see that this waiting time could be reduced, because what could earlier have taken 30 minutes could be now completed within maybe a span of 3 minutes or 5 minutes. Now this is going to be beneficial both for the patient, because the waiting time as well as the registration time is going to get reduced. At the same time, even for the hospital, in terms of its operational efficiency, the hospital is going to save a lot of time as well as resources in terms of getting this data, because it need not entirely create a fresh set of the patient data. Rather, it can directly take the data that is already available using the EHR
that saves
facility.
Time and effort.
Yes, madam.
Part of both. Sir, Acharyulu sir, already the hospitals are using hospital management information system. How this hospital management information system and healthcare analytics are different?
This hospital management information system is going to collect the data, and it is going to organize and store the data as it is in the raw form. And this hospital information system, hospital management information system, is going to organize all the data in a meaningful manner. And this actually the patient, it is the function of hospital management information system is to look at the administrative data and functional data, these two data. So, but remaining clinical and other things will be EHR and other EMR will be going out. But the first point of contact, the patient is going to register through hospital management information system, through which everything is going to be done. And this is going to what actually this hospital management system is going to tell what data is available and what is the present situation. But healthcare analytics is going to make use of the particular data and see that how meaningful insights can be drawn out and how it is going to be helpful for data driven decision making. based on that.
Oh,
Yeah.
okay, thank you. Kumar sir, what are the different tools and technologies used in healthcare analytics?
Okay, coming to the tools and technologies that are used in the context of healthcare analytics, now this is going to be a very vast area because we do have tools and technologies related to the clinical side as well as the non-clinical side also.
Different technologies.
Different types of technologies are there, madam, because since we are talking about the healthcare, say for example, if I look at directly something that is being used in the context of let's say clinical side, I realize that you have different procedures that have got evolved because of the deployment of artificial intelligence as well as machine learning, right? Say for example, when we look at the robotic surgeries, where the kind of precision that is achieved is very much better compared to that of a human being operating. Now that is a great revolution in terms of the technology being used directly on the patient. But of course, the doctor is always there. We are not leaving everything to the technology part. That is one aspect in terms of technology being directly used in terms of the clinical procedure. But when we look at the other part of it, say for example, when I am talking about the deployment of let's say databases, right? A lot of information related to the patient is captured using the databases. Now, this data could be used further in terms of maybe predictive analytics or even prescriptive analytics, as we have discussed earlier. Now, apart from this, if I look at the most interesting part of the technology in the healthcare today, we are talking about wearable devices. Now, a patient can have a patch that is attached to his body that could be in real time sending a lot of information about the vitals of the patient to the healthcare service provider. The interesting thing here is, because of the connectivity, the patient need not be in the vicinity of the hospital or in the vicinity of the doctor, but because this connectivity is there, in real time things could be monitored remotely. At the same time, if any intervention is needed, right, because the data is almost real time, appropriate interventions can be done. Like I said earlier, using maybe predictive technologies. Before even maybe a fatal event occurring, because of the predictive analytics being deployed, using the data, the doctor can take a decision well ahead of the particular fatal error being occurred. So, if you look at the kind of tools and technologies today, it is very vast. In fact, so on one side we have the technology that is being used on the clinical side, and of course on the non-clinical side, and then of course when you look at the operational side, right, how an hospital could really improve in terms of its operations. Today you have robots could be used not only in the surgeries, but also robots that could be used in terms of, let's say, the delivery of the medicines, or robots that could be used in terms of doing the regular things like maybe taking care of the hygiene of the hospital. Instead of using human beings, these robots could be doing this. So this is going to be a very vast area where healthcare offers us a good example in terms of how technology could be deployed in multiple dimensions. That's it, madam.
So, what is patient outcome, G.V.R.K, sir?
Yeah, now patient outcome is very important. Finally,
because our topic itself is
so one of the components of this topic is
outcomes.
patient outcomes.
Yeah.
So patient outcome is actually one of the important areas, outcomes of the hospital. So if you can see very clearly, the patient outcome is how it measures how patient is. So how do we say that? So when the patient is, suppose the patient is discharged, so whether the patient is happy or not happy. The patient is happy means that's the best outcome. So most of the hospital, they want to see that patient should be a smiling patient, or after surgery the patient should be the recovery. If the patient is recovered very fastly, that is the outcome. And patient, suppose like that, the patient outcomes, if you see the waiting time. So the waiting time is minimized. Suppose if we take OPD waiting time is 90 minutes or 60 minutes. Suppose if the patient is, if you can reduce waiting time by 30 minutes, so definitely that is an outcome. That means more number of patients can be seen. And also discharge time is an outcome. So how much time the patient is taking, the hospital is taking to discharge a patient. It can be 3 hours, 4 hours, depends on the kind of surgery and depends on the complexity of the operation. So if you are able to see that the patient is going to be, if any delay in the discharge, if any delay any waiting time is there, that is going to affect the patient outcomes. So that's what that's very important, patient outcome.
But normally in hospitals, the discharge takes normally some 6 to minimum 4 to 5 hours.
Yeah, 4 to 5 hours, but
the discharge process.
If they are able to manage, integrate all the information across different departments, it is going to happen.
Professor Srinivas, I just want to add something to this. What is patient outcome, and with some practical examples. How to improve the quality of service to the patients, how to reduce the waiting time and all those things.
Okay. So, quality in terms of healthcare services is going to be a very interesting scenario, madam, because when we look at healthcare as one of the what you call distinctive examples of services marketing. Now, interesting perspective here is the patient has to be satisfied in multiple dimensions. One is when we talk about the quality, the technical side of the quality is there, and the second one is the functional side of the quality. Technical side of the quality is basically the outcome. Say for example, a surgery has been performed, right? Now, what is the outcome of this particular surgery? Whether the purpose with which the surgery has been done, whether we have achieved it or not, is the patient happy about the outcome or not? Can the patient really what you call perceive the difference before surgery and after surgery? The second one is the functional quality. Say for example, the doctor talks to the patient. A patient is always happy when the doctor talks to the or speaks to the patient, because he feels that he is getting some kind of an attention from the service provider, right? But at the same time, doctor may not have the time to sit and talk with the patient, right? Doctor basically performs his duty and leaves. So, always we are trying to look at achieving a balance between the functional quality as well as the technical quality. Now, which is better? Now, the interesting perspective here is whenever we are looking at services, the major problem especially in healthcare service is that like a product, the patient will not take anything back, right? When I am going for either the treatment in terms of a outpatient as well as an inpatient, I do not carry a product back with me like the way I shop something at an electronic store, but I am paying for the service that is there. So, like as you said madam, there are multiple components. Say for example, can I improve the issues related to the waiting time of the patient? Now, analytics offers a solution. I am not saying that like magic we are going to transform everything, but then if I can properly look in terms of maybe modeling the arrival times of the patient and probably the time that is taken for consultation, right? I can give approximately maybe a 10 minutes window time period for the patient to come, so that he need not wait for hours to get his appointment with the doctor. Similarly, we start looking at maybe the inpatient treatment in terms of the availability of the beds, in terms of optimization of the available resources with the organization. In all these cases, the hope is that if we can properly make use of the data or the information that is available, and using the kind of analytical techniques that are available today, we can make a lot of difference to the patient as well as the service provider also. So, that is where the promise of improving the healthcare quality is very much there with the deployment of healthcare analytics, madam.
Yeah, thank you, sir. Acharya sir, what are the key indicators or performance metrics the hospital managers monitor through this analytics to improve the quality, efficiency and patient outcomes?
So, normally the key performance indicators should be a very specific, specific in the sense smart indicators. Smart indicators in the sense smart means S means specific, M means meaningful, and R means reliable and relevant, and then R means T means time bound.
Time bound.
So, so whatever indicators that are there, suppose if you see in the hospital the key performance indicators for inpatient, for outpatient department and emergency department and operation theatre department. So, these key performance, some of the key performance indicators are common to all the departments and some of them are specific to the department. Suppose if you say the inpatient department, so inpatient department the key performance indicators about what is the arrival time of patient and what kind of surgery that is planned and what kind of tests are to be done and what is the turnaround time. That is also one of the key performance indicators. So like that we have how much time that is required, the surgery that is required. So all these things are inpatient key indicators, and outpatient key indicators are going to be again arrival time and also the registration time, and then consultation time, and then finally diagnostic time and other times. All these things are key performance indicators. How much time? So all these key performance indicators are going to be with respect to time. And operation theatre utilization. So whether how many beds are there, and how much time, what is the average length of stay. All these things are key performance indicators in the operation theatre. Emergency response time. From the emergency department you have a emergency response time. What is triage waiting time. So all these things are emergency department. So that's why the key performance indicators are going to be really crucial for managing the quality of service and patient care and patient safety.
Srinivas, would you like to add something on these key indicators?
Okay, madam. Say for example, when we are talking about the usage of data, there are multiple parameters that could be actually measured. But then the interesting perspective here is everything that is measured.
Srinivas, I just want you to throw some more light on specific departments like OP, IP.
Okay.
What are the indicators more?
Okay, let me take an example, madam. If I take the operation theatre, right? So how much time it would take once an operation or a surgery is completed, where the tooling, everything is taken back, and then the operation theatre gets ready for the next patient. Now, if I have an idea about this, basically, I can go with better scheduling of my operations when it comes to management of my operation theatre. Similarly, when I start looking in terms of the key indicators that are related to, say for example, the number of beds available versus the number of inpatients, right? So how can I basically look in terms of making a promise to a patient who is looking for getting an admission as an inpatient? Because in most of the cases, there will not be a perfect balance in terms of the supply and demand of both the what you call incoming patients as well as the available resources. So this could be one more perspective in terms of looking at the key performance indicators. And of course, the other key performance indicators also could be related to the financial parameters that are there, right? Like say for example, any organization that basically survives on the basis of the revenue it gets generated. You have KPIs in terms of what is the rate at which maybe your cash burn is there, maybe what is your return on investment, right? This could be the other key performance indicators apart from the patient as well as the resources.
Yeah, thank you. Acharya sir, suppose all of a sudden there is sudden increase in the inflow into the emergency department of a hospital. How to manage the situation, and which type of tool is more useful in this particular situation to take a better decision and manage the flow of patients? Suppose all of a sudden some calamity is there.
So hospitals experience sometimes this kind of situation, and the management of the particular situation is very important. So suddenly the inpatient flow is increased by 30%, 40%, sometimes 50% also. Maybe suppose in the rainy season. If rainy season, dengue and other fevers, patients are going to be more. So in that case, the patient turnover is going to be very high. So in how you are going to plan your resources, that's very important. So the analytics is going to play a crucial role, and it is going to predict how if the rate is going to increase, then how you are going to plan in advance to see that the patient care is not going to be affected. Like you're planning your beds, planning your staff, and planning the different kinds of medicines. All these things are to be done. Like in COVID also we have seen most of the patients, most of the hospitals, they have managed the oxygen requirements and then the medicines requirement and the beds requirement, ICUs, all these things. That's why that is very important. So how you are going to cope up with this kind of situation, the analytics will tell in advance, the early signal, that how you can do before. Once after incident happened, you cannot take all kinds of measures. But before incidents is going to happen, the analytics will tell you the predict it, how it is going to happen, why it is the surge in demand, why it is happening, what could be the reason. So accordingly, if the cycle repeats, they are going to be prepared for that situation, like disaster management recovery.
Disaster management, Before actually we proceed further, let me announce the phone numbers once again. It's 040-23680-456, 23680-456. So if the participants, if they want to seek any clarification on the area of discussion, you please call on the number and sought clarification from the resource persons. So, Professor Srinivas, there is another important concept is data mining.
Yes.
So, what is this data mining and how it is useful in this particular area?
Okay, madam. So, data mining is a very important concept in the context of analytics, madam. To give a brief historical perspective in terms of how this term has arrived, if you look at the deployment of databases among the organizations, including the hospitals, right? So, it has been almost 2 to 3 decades that almost every organization started using databases where they started collecting the data. Now, over a period of time, all the organizations started having huge amounts of data. Now, the interesting question here is that if I can make an analysis of this particular data, right, using the right kind of tools and techniques, if I am able to make an analysis of this data, can I find meaningful patterns within the data? Can I find meaningful patterns within the data? So, a simple way of looking at data mining is that data mining is a term that is used in the context of large databases where you try to identify the patterns that are there, and these patterns would probably help you in terms of getting some meaningful insights based on the data that is available. Now, say for example, if I am trying to look in terms of the context of a hospital, right. So, when I am looking at a particular hospital data, when I try to analyze this particular data, can I find that, say for example, the incidence of a particular disease is more in this particular age group, or maybe in this particular gender, or maybe in this particular geographical location. So, what is happening here is I am not making a guess, but rather I am actually looking at making use of the data available with me. And remember, this is not simple data, this is vast amounts of data, because we are talking about a huge amount of data that is available in the databases. The only thing is that do I have the right kind of techniques that are available? To just give you an example, if I can take one of the examples of data mining known as clustering, right? Yes. So, from a very heterogeneous group of patients, can I use clustering as a technique to get homogeneous groups? That means relatively homogeneous groups. All of them are patients, but at the same time, when I try to look at the characteristics of these patients, if I am able to deploy something like hierarchical clustering or K-means clustering as a simple example, what it could do is it could generate the cluster saying that, okay, among the huge database of the patients, now these are the clusters that I could identify. Now, the next part is basically looking in terms of what do these clusters basically communicate to us. When I look at the characteristics of these clusters, each cluster, even though the data is related to the entire population of these particular patients, each cluster would give us an idea in terms of what are the specific characteristics of these patients, or maybe what are the specific problems of this cluster compared to the other cluster, and thereby I will get a better insight into the data, madam.
So, thank you, sir. Sir, actually, while discussing the importance of healthcare analytics, Acharyulu sir, you said that it is very important in reducing the healthcare cost. So, I request you to explain what is healthcare cost, what are the methods used to predict this healthcare cost, and how to reduce the healthcare cost. That's actually the most important thing.
So, ultimately the hospitals are going to look at how they are going to reduce the costs. So, the healthcare cost,
it depends on the cost, only they just price the services.
The major problem in the healthcare industry is the costs are escalating like anything. So, how do you manage the cost? So, actually the cost prediction from the healthcare analytics point of view is to see that budget, what is the cost expenditure that is going to be happening. Suppose from the patient point of view, suppose the patient is insurance patient. So, we should be able to tell what is the estimate. So that patient is going to be ready, he is planning for the expenditure, and also insurance provider also he is going to how much amount to be claimed. So, like that, suppose this cost prediction is going to happen based on previous so many surgeries. Let us say that one particular surgery is done for many patients. So, the average, suppose cardiac surgery is 4 lakhs. So, that is based on the previous data, previous information, the 4 lakhs is the estimate, and that estimate can be including everything, medical and physiotherapy and everything, surgery, everything. So, that is going to be estimate, that is what cost estimation. and that will be whenever new patient comes, you will be having idea, and also the insurance companies also will be having idea of how much claim should be done, and the hospital also at the same time how much revenue they are going to get, based on which the cost estimation is going to happen, and cost per patient, cost per bed, and cost per surgery, and how these you can also look at benchmarking of
sir, other facilities opted by the patient. Maybe some may prefer the shared room, or some may prefer a single room, or a luxury room.
Yes.
Everything.
Like a package. Like
it's a package. Yeah. So I request Srinivas Kumar sir to add something to this cost reduction. How to reduce cost?
Just to add to this cost reduction, madam, there are different types of perspectives when it comes to what are the drivers of the cost.
Yeah.
There are certain essentialities where you can't compromise, the cost is bound to be there. But at the same time, there are certain areas where we need to really ask these questions in terms of are these facilities, or maybe is this kind of material or is this kind of infrastructure really required. Say for example, one of the doctor was sharing this idea with us, saying that should you really have granite flooring in your hospital? Does it really? Definitely in terms of the image of the hospital it is going to help, but at the same time when it comes to the cost, who is going to bear the cost for it? So one perspective is that which are the areas where you can't compromise, because those costs cannot be reduced, that will have a direct impact in terms of the patient treatment as well as the outcome of the patient. But at the same time, if you can look at some of the optional things, like you said, a patient can choose either to go with a single room or a shared room, or maybe if possible maybe even a shared dormitory kind of a thing. So the basic idea here is the cost has to be defined from the perspective of your target customer, right? Who is my target patient? What is the kind of profile of the patient whom I am planning to serve? For this patient, if this cost is bearable, maybe that may not be a major issue. But if you are trying to really look at patients who may not be able to afford, now you need to change the modalities of your what you call service delivery without compromising on the core part of the healthcare, where wherever possible the cost could be reduced.
Nowadays there are so many technological inventions and interventions in patient services. Is it going to increase the cost or decrease the cost?
Okay, madam. So if I am looking at the technological interventions, say for example, when I am looking at the high-end technology, definitely the cost is going to increase, but then the benefit is that the precision is going to be there. So in that particular case, say for example, if I am preferring for robotic surgery instead of a surgery by a surgeon, definitely, say for example, if I am talking about a robotic surgery where one of the popular robot that is used is what is known as a Da Vinci, anywhere it could go up to 20 crores, right? So there, if I am looking at really using the services of this particular robot, the cost is going to be high. But even in those areas, there is a bit of hope. An Indian equivalent of Da Vinci known as SSI is there, which comes at 1/4 to 1/5 of the cost of the Da Vinci. So the interesting perspective here is again you can have a choice in terms of whether you would like to go with maybe an Indian made version of the robot, or you would like to go with the imported version of this. It is just like whenever we are going for surgery, say for example, when you are going with knee replacement, people talk in terms of whether you would like to have an imported one or whether you would like to have a local one kind of a scenario. So when we are trying to talk about the cost part of it, the only critical element is that which are the areas where you can reduce the cost and which are the areas where the cost cannot be reduced. And second thing is, most of the technological interventions at the beginning they cost a lot, but over a period of time as the usage increases, the cost is going to come down.
So Professor Acharyulu sir, I just want you to throw some light on this blockchain. How this blockchain is going to help the healthcare industry, and with specifically in data security and interoperability.
Yeah. So blockchain technology is the most advanced technology which is very much useful in healthcare industry. So blockchain is a trust technology. So how do you trust the data and how do you secure the data, and the data is going to be stored in different layers, distributed ledger, where tamper proof data is available and nobody can actually access the data unless you give permissions. And also the data is going to be stored in different places and nobody can tamper it. And also the security point of view is highly secured for the patient data. So when the patient is going to one hospital, other hospital with the electronic health records, then automatically if it is blockchain enabled, definitely the patient, actually the doctor is going to access the electronic health records of particular patient based on the consent only. Based on the patient consent only. So he will be accessing without any problem. So that is one aspect. But again, interoperability is also one of the important issue here. But you have to ensure that interoperability from one system to other system is a major constraint here. But you have to find out the align with the interoperability. The same system should be there. And also the blockchain is going to, you have to give a access to the patients and right patient and right data and right decision. So that's how the blockchain is very important.
Okay, thank you, sir. Professor Srinivas, nowadays everybody is talking about big data. Wherever you see, everybody is talking. How this big data is helpful in achieving all the benefits which we are discussing so far, improving patient
outcomes,
satisfaction or outcome or whatever it is, reducing the cost and everything.
Right, madam.
Yeah.
So when we look at this particular big data basically comes with 4 different types of characteristics, madam. One is what is known as the volume of the data, the second one is what is termed as the velocity of the data, and third one is what is known as the veracity of the data, and then of course the value of the data is also there. So when we look at these aspects of the big data, now volume, when we are talking about the volume is going to be very huge, right? So for example, if you have some 1,000 patients with some wearable devices continuously giving you the data, just imagine the amount of data that would be received by the server. And at the same time, you also look in terms of the rate at which the data is entering into the server. That is basically related to the velocity part of it. And of course, when we start looking in terms of the veracity is basically where we are talking about the trustworthiness of the data. Data is there, but at the same time, is this data corrupted? Can this data, especially because the data comes in different formats, like we have discussed earlier, one could be in the voice format, one could be in the text format, one could be in the picture format, one could be in the video format, right? So what is the veracity, trustworthiness of the data in terms of our ability to use all this? So when we look at this scenario, together the data that qualifies on this 4 ways is basically what is termed as big data. Now coming to the healthcare perspective, we have already seen that right from the medical transcriptions, which are basically based on the text, to maybe your what you call MRI data and other kinds of data which could be highly digital data. The whole idea is that can we basically leverage this data to get an insight. But then interestingly, when we start the big data part and using the analytics on this, say for example, if I am trying to look at the outcome of an MRI, now there could be somewhere around 50 to 100 frames of a particular patient's data. Now manually someone has to go through this each of the frames and then identify. So for example, if you are talking about a radiologist, he should be able to identify what is the issue or what is the problem with this particular patient. Say for example, if I have a trained machine, say for example, when I am trying to look at the usage of artificial intelligence, maybe a small speck which may not be, which a person, a human being may not be able to identify, can be actually recognized by this particular what you call deep learning technique or any other techniques which we use as a part of the artificial intelligence. Now what is happening here is you are able to make a very early detection of something which otherwise would not have been possible. Now this is a very interesting case where some of the big data can be really leveraged in terms of getting insights. One aspect of the healthcare data that I am talking about. So what happens here is definitely the patient is going to get the treatment at a very early stage of that particular problem, and probably the patient is going to incur less cost, and probably the patient is going to incur less pain. At the end of the day, all these will contribute to a better outcome for the patient as well as improving the satisfaction of the patient.
Thank you, sir. Sir, all this data collected by the hospitals may be stored in some cloud systems or some other platforms. How to protect them? Acharyulu sir.
So, how do you manage the data on cloud system is very challenging. So, proper management of this data on cloud system is very important, because when you store the large amounts of data in cloud system, so definitely security and security of the data is there, and also volume of the data can be more, and you can access very fastly. But here the cloud systems, what happens is mostly most of the times the cloud systems, since high security is there, so how do you manage that data on cloud is very important. But there are some disruptions that are going to happen, which are going to hamper the hospital operations. So, one more important aspect in the cloud system is when you have a precautionary systems in place, that is good, like data recovery and data backup, and any kind of disruption happens, how do you recapitulate that particular data. All these things are very important from the security point of view. But otherwise the cloud systems are really good, very efficient, and you can access very fastly, and processing is very fast and accurate and faster.
Professor Srinivas,
Madam.
how these cyber attacks, do the health organizations, do they have any threats from the cyber attacks?
Yes, madam. Cyber attacks is really a present and a real kind of a threat for any of the organizations that store data, not only on their internal servers but also on the cloud. So, the first thing is that when I talk about the cyber attack in the context of a hospital, now there are a few issues that we need to look at. One is the data of the patients. Now, generally the data of the patients is considered to be very private, right, to the patient. Now, we are compromising on that. That is one thing. Second one is that if I am dependent on the information systems in my day-to-day working and there is a cyber attack, the immediate problem that I am going to face is that my operations are going to come down, because I am under attack, right. I cannot access my data, and like I said earlier, we are going to use data for most of our decision making. So, in this context, the first part is that we need to take adequate security measures. Say for example, to start with the simplest thing like the encryption part of it, right, and then looking at how to have the right kind of what you call firewalls and other techniques that would actually help us in terms of securing this data. The second part is that when I am under attack, how do I restore my operations? Now, this is where we talk about falling back on the emergency kind of services, where you need to have a system which could actually anticipating a cyber attack or any other kind of a calamity where you might be actually losing your information. You need to have a backup that has to be available. So, when this backup is available, you can actually fall back on the backup. At the same time, ensure that this backup again is not again connected to the internet, because again you could have a second attack that could also fall.
Yes.
And your basic priority has to be in terms of the patient care. So, patient care comes first beyond anything else, madam.
So, thank you. Because I am afraid the time is running out, I just request both the resource person just to give a few tips for the prospective managers in this particular field, healthcare analytics.
So, from the perspective of future healthcare managers,
Yeah.
MBA healthcare and hospital healthcare management students, so they are not just simply managing hospital beds and other things, but they should also know about what are the digital technologies and future technologies that are going to happen, because in future everything is on smart hospitals.
Yeah.
So, that is why it is not that simply experience based, it is evidence based systems are coming up in, and how you are going to not only your clinical knowledge and financial knowledge and operational knowledge, whatever it may, but the digital knowledge is also very important. And of course, AI and other digital technologies are not going to replace human beings, but human beings who are not aware of all these technologies, that they are going to be replaced. That threat is there, and we should be very careful.
So, thank you very much, sir. Let me take this opportunity to thank both the resource persons, Professor G.V.K. Acharyulu sir and Srinivas Kumar sir, for sparing their valuable time and being with us in our studios today. So, thank you very much. Thank you. Bye-bye.